Young adults after a cancer diagnosis. Although cancer in young adults is rare, it does happen. The American Cancer Society estimated in 2020 that about 80,000 young adults between the ages of 18 to 39 will be diagnosed with cancer in the United States. The most common types of cancer for young adults include leukemia, lymphoma, thyroid, breast, and testicular cancers. Other less common types of cancer can also occur in young adults. When you are told that you have cancer, you may need to give yourself a little time to let the news just sink in. It is common to have a wave of emotions after learning you have cancer. These emotions may include feelings of shock, fear, anxiety, anger, sadness, or being overwhelmed. It is important to know these feelings are normal and may continue throughout your cancer experience. Life as a young adult has many big turning points, but no one plans for cancer to be one of them. During these years, there are many milestones, such as establishing your identity, choosing to continue your education, selecting a career, and becoming comfortable with your body image. You may also wish to start a family. While cancer may redirect your priorities, these milestone goals are still important. A goal for young adults is moving forward with a sense of purpose and control over their lives. Learning that you have cancer can make things feel very out of control. Seeking information about your cancer and cancer treatment can help you feel more in control of your situation and help you determine what adjustments may be needed to your plans. It may take time to feel well informed about your cancer and cancer treatment. At first, you will have many questions and may need the information repeated or details explained. The medical terms used during your care can be very confusing and hard to remember. It is important to ask questions about your cancer and cancer treatment. Learn how the diagnosis and treatment may affect other parts of your life. Write down your questions and take them with you to your doctor's appointment. Some questions may include, tell me about my type of cancer. How serious is this type of cancer? What type of cancer treatment will I need and how long will it take? What is the possible outcome of my cancer treatment? What are some side effects of the treatment? How will the cancer or cancer treatments affect the way I look? Are there any clinical trials available for my type of cancer? Will the treatment affect my ability to have children? What can I do to preserve my fertility? Will I be able to work or go to school during my cancer treatment? Who can I talk to about financial concerns? If you don't understand an answer to a question, don't be afraid to ask your healthcare team to explain it again, but in a different way. Members of your cancer healthcare team are the best source for health information. They can also provide you with helpful internet resources for you to review. Get to know your healthcare team and let them get to know you too. Look for a doctor that you feel you can talk to and provides care specifically for young adults with cancer. These specialized services can be found at a comprehensive cancer center like the James Cancer Hospital at the Ohio State University Wexner Medical Center in Columbus, Ohio. There may be times when you feel overwhelmed with information during a doctor or hospital visit, or simply just do not feel well. It might be helpful to have someone go with you to your medical appointments to ask the questions and take notes for you. During this stressful time, reach out to your emotional support system, such as family or friends. It may take time before you are able to talk about your cancer, and that is okay. Some young adults with cancer say they did not reach out to others because they thought their loved ones might not get it. They felt if others were not cancer survivors themselves, they would not understand. Others choose not to share health information with their loved ones because they did not want to upset them. However, many young adults with cancer found that sharing their feelings actually helped to make their relationships stronger and provided needed support. Some people in your support system may be better at doing things to help you, and others may be better at talking with you about your feelings. Let your family and friends know how they can help. If it is overwhelming to keep updating people, ask one person in your support system to pass the information on to others. In some cases, it may be helpful to talk to a professional counselor, social worker, or religious leader about your feelings and ideas for how to cope with life after your cancer diagnosis. Some young adults find comfort by getting involved with online communities. These online support sites may include others with your type of cancer or those diagnosed with cancer at a similar age. You may find you share the same issues, fears, and concerns. There may be in-person support groups available in your area. Contact the James at 800-293-5066 or your local cancer hospital to learn more about programs for young adults with cancer. As you interact with or hear about other young adults who have cancer, remember each person responds differently to treatment and may have different health experiences and recovery timelines. There are many types of support to help you find balance in your life after a cancer diagnosis. You may want to try several before deciding what is best for you. Try to stay as active and involved as much as possible, and do things that you enjoy. We don't always think about being a mother or father when we are young. However, it is important to know how your cancer treatments could affect your body's ability to have children. The impact on your fertility is often based on the location of your cancer or the type of cancer treatment you receive. Before you start your cancer treatment, talk to a fertility specialist about sperm banking or preservation of eggs or other fertility-protecting methods for later use. In some cases, you must start your cancer treatment as soon as possible. It is still important to meet with a fertility specialist even if treatment has already begun. If you are a woman of childbearing years, make sure your doctor confirms you are not pregnant before medical testing and cancer treatments begin. Also, let them know if you are currently breastfeeding. Your doctor will talk with you about what steps should be taken to prevent pregnancy during your cancer treatments, and in some cases for a certain period after your treatment ends. Sexuality can also be a concern for young adults with cancer. Cancer and cancer treatments can change the way you look and feel about yourself. For example, you may see changes in your weight or have hair loss. These changes may make you feel less attractive or worry about your ability to have or enjoy sex. It is important to share your concerns with your partner and your healthcare team. There are doctors, support groups, and other resources that can help answer your questions and share ways to manage any sexual problems. Many young adults are also parents. Cancer and its treatment can change relationships between parents with cancer and their young children. It can be a challenge to balance parenting roles, work, school, and medical appointments while managing routine daily activities such as cleaning, meal preparation, and laundry. There is often a disruption to everyone's routine in the family. There may be days you do not feel well and are unable to fill the roles you have played in the past for your children. Your culture may affect your response to these changes if there are set expectations for your role and the tasks you manage for the family. You may not know the words to use or how much to share with your children about your cancer and its treatment. Ask your healthcare team about how to best talk to your children based on their age and level of development. Always let your child know it is okay to come to you with questions or concerns at any time. After a cancer diagnosis, there may be a need to change your educational plans. For example, you may delay starting college, take a semester off, or take only online classes. Talk to your school administrators to see what options may be available for you. Most schools have a disability service office that can help with special accommodations that may be helpful for you. Accommodations may include a flexible attendance schedule or use of a note taker in your absence. This office can also help if you need to withdraw from classes or take a leave of absence. It is important to connect with these services as soon as possible after your diagnosis. You may also have concerns about how having cancer may affect working at your job during treatment. Talk with the Human Resources Department and your supervisor about your job benefits. It is important to understand your insurance and time off options. A social worker for cancer patients can share information about programs that may offer financial help if you are unable to work during treatment. It is important for you to have a healthcare team to support you during this time. Your team may include doctors, pharmacists, social workers, dietitians, and others. You are also an important member of this team. Keep a contact list for your healthcare team members with a note reminding you of the role they have in your care. You will develop a lasting relationship with your cancer specialist and other members of your cancer care team. This connection will start at your time of diagnosis and continue after your cancer treatment ends. After you finish your cancer treatment, you will have follow-up appointments for routine monitoring to check any new symptoms and to help you manage any side effects that are not well controlled. It is very important to go to all of your doctor's appointments, tests, or procedures before, during, and after your cancer treatment has ended. These appointments are important to help measure your progress during treatment, manage any symptoms or side effects you may have, answer your questions, and adjust your care as needed. Your role as a member of your healthcare team also includes the need for you to make healthy choices to keep your body feeling its best. This includes no tanning, no use of tobacco products, and limiting your alcohol intake. You should try to exercise regularly and eat healthy, nutritious meals. We hope this information has helped you to better understand some ways to manage the changes often experienced as a young adult with cancer. Write down any questions you might have for your healthcare team and bring them with you to each appointment. We are honored to care for you during your cancer treatment. Thank you for choosing the James.